This is Heart Rhythm TV, and I am Julie Shea here with another episode of Advancing Allies. With me here today, I have Dr. Charles Love, who's the Director of Cardiac Rhythm Device Services and a Professor of Medicine at Johns Hopkins in Baltimore, Maryland. And he is also President of the International Board of Heart Rhythm Examiners, also known as IBHRE. Now, IBHRE is an organization that oversees examination which tests specific competencies necessary to provide quality patient care in cardiac pacing and electrophysiology. And for allied professionals, this includes cardiac implantable electronic devices, cardiac electrophysiology, and remote monitoring. So with that, Dr. Love, welcome to Advancing Allies.
Thanks, Julie. Great to be here to see you again. It's been a few years since we did our last interview, so delighted to be part of this again.
Yeah, I think, the IBHRE certification exam is so important for allied professionals. So I appreciate this opportunity to speak with you today so we can explore that a little bit more. So I understand that next year IBHRE celebrates 40 years, which is absolutely amazing. What do you believe to be the greatest impact that IBHRE certification has for patient outcomes?
I think the biggest thing is that we encourage the education of our certificates, and people need to go and learn and study and get exposed to things in the lab, in device clinics, wherever. And not only do they need to absorb that education in a didactic sense, but they need to be able to demonstrate that by passing a certification examination. We have over 9,000 people certified worldwide at this point, probably pushing 10,000 right now. And for many of these people, it's really important. For several of the institutions that I've worked at, it's a difference in salary. There is a salary bump for people that are certified, so that's important. And for the institutions, having certified device people or certified lab people certainly means that they can achieve magnet status, which is very important for those institutions and for the people working there. So there's a lot of good reasons for people to get certified.
Yeah, and I think it really raises the bar too. I mean, our patients are the ones that we're truly doing this for, right? So that, making sure that people are competent and doing things in a quality way is important. And I think that the exam helps to demonstrate that. So
I think that's really true. And when people come and ask me, boy, is there a doctor in, a certain state, a certain city, and I might not know anybody in that area, but I jump on the HRS website and you can look up and see who is certified as a device specialist if you want to get your device checked in that area, in that geographic area. So it's a good way to at least get somebody that has got a certain level of competency in device therapy for that, for example, or we're looking to hire people into the lab, or when reps come in to run these mapping systems, how do we know that they really have a good understanding of what it is that they're doing and what our needs are? And when they show me on their business card, oh, I'm a certified electrophysiology specialist, I know right away they know a lot of EP. So it really demonstrates that these people at least have that base level of competency in terms of the information that we use on a day-to-day basis.
Absolutely, it's great advice. So back in 2022, IBHRE launched its new continuous competency program, or IBHRE C3 as it's known. Why is it important to maintain an IBHRE certification, and what has been the impact of the C3 program?
Wow, if we look back over what's happened just over the last few years, our profession has continued to accelerate in terms of new knowledge. I mean, things like pulse field ablation, conduction system pacing, left bundle area pacing, all of the new device technologies that have come along, and just new EP techniques that are coming along. So we are a dynamic profession. We're not static. So we need to have a way to encourage people that have certified at one point in time to continue that learning process. And we'd like to do that in a lower stress environment than having to, cram for an exam and sit down once every 10 years for 4.5 hours at an expense of over $1,000 in order to be able to do that. Our IBHRE C3 program allows candidates to do this at their own pace over a 2-year period, to simply review a total of 12 different articles or more if they need to, but to pass 12 assessments. And this is done in open book, no time limit. the idea here is not to pressure people and get them all cranked up, but it is to encourage that learning and then to demonstrate that they have obtained the key points of information in those papers. So it saves money, it saves a lot of stress for people, and it encourages them to continue to read these articles that have a very broad kind of appeal. They're review articles or articles on new technologies, and it's not a tough thing to do. It's really easy, and so far we've actually had really good feedback about it.
Yeah, I actually did it. I finished up in the end of 2022, did my recertification. I thought it was great. I mean, was able to demonstrate my knowledge of various areas within electrophysiology, but I learned a few new things. So again, kind of promoting this continuous, demonstration of competencies, but also learning at the same time. So important. Was going to ask you the next question in terms of what do you think the future for IBHRE with regards to maintaining or increasing the number of heart rhythm examiners certified? Do you anticipate an even greater span internationally?
So yeah, that's a great question too. So we have just started working with one of the folks in Australia, one of their organizations, to try to get our examination to be utilized as a kind of a state approved certification exam for some of their folks. Over the last 10 years, we've had a great collaboration with folks in Japan, and indeed the Japanese reps are not allowed to work in a clinical areas without being certified. Well, in Japan, they didn't have a certification exam. So they came to us, and we developed, in cooperation with the Japanese Heart Rhythm Society and the Device Representatives Organization, an examination specific for the Japanese device reps. So they get a credential called CCDS CDR, Certified Device Representative. And that's actually pretty much the same thing as our CCDS exam, a little bit more tailored to the Japanese society and some of their particular needs. But we've certified over 1,000 Japanese device reps now, and they're coming back through for recertification now. It's a great collaboration with them. Each year at HRS, we meet with the folks from the Asia Pacific Heart Rhythm Society, Latin America Heart Rhythm Society, and the Middle Eastern Heart Rhythm Societies, and we're working with them to try to collaborate and build the program up to the point where as they develop their heart rhythm societies and their knowledge, their group of people with greater need for certification, that we hope to be able to get our exam into those other countries. We actually worked with China for a period of time. The Chinese were very interested. We signed this letter of agreement with them. In the end, they kind of decided to go off and do their own thing. But we're always looking to partner with people internationally, because it's just a great opportunity for us to meet people, to work with people, and to set this international bar, because we have a competency exam. Everybody who takes this exam theoretically can pass it or fail it. It's not curved. It's based on a certain level of competency, and if you achieve that level, you pass. It's as simple as that.
Absolutely. So how does content get added? I mean, obviously, you brought up the point that we now have newer technology. We've got pulse field ablation, we've got physiologic pacing. So how does that data, like the exams and the papers, get updated longitudinally?
Great question. So quarterly, we put out a request to people on our writing committees from the different exams to submit papers that they have read through different journals, and that can be Heart Rhythm, JACC-EP, JCE, JCI, was it Journal of all of the different EP journals, and even some of the general journals have really good review articles. So we pull those articles out, they go to the chairs of those committees, and they give them a thumbs up or thumbs down. Sometimes they're just too specific, or they're just not going to have as broad a focus as we would like them to have, or they're just too cutting edge, and people just haven't, that technology hasn't really gotten out there yet. So for example, a year or two ago, we probably wouldn't be putting papers out on pulse field ablation because it was not FDA approved. It really was still considered experimental, and we don't test on those kinds of things, nor do we expect our broader examinee cohort to have to read about those things at that time. But now that it is FDA approved, now we will start gathering papers that talk about it, that will educate people about it, because they're going to see it in their labs. It's already getting very wide distribution, certainly La Fondo area pacing in the last year, all of a sudden everybody's doing it. So I can't remember the last time I dropped a lead in the RV Apex anymore, except maybe for an ICD. But these are things that we now have recognized. Okay, these are important. So we look at those papers. Then once they're approved, people are assigned to write questions on those papers. We have 5 questions on each paper, and those questions are then they go through a committee, they're reviewed and edited until they are put out there. And then we review the performance of those questions as well. Sometimes we keyed them wrong. Sometimes we've got the wrong answer in there, or we end up being too confusing. So we will go in and modify those questions as is needed.
Yeah, that's great. So continuous feedback about it and updating. So it's a fluid, dynamic process.
Yep.
All right. So what words of wisdom do you have for allied professionals who are considering earning an IBHRE certification?
Well, first of all, if you want to really pursue a career in EP or device therapy, getting that IBHRE certification is really a way to prove that you have that good level of knowledge, and people will look at you and really say, wow, okay, that person has at least that good level of competency. So I always recommend learn as much as you can. Don't be in a rush to get the certification, and you're eligible after 2 years of working in the field, or there's some other pathways in there. But sometimes that's not quite enough, but you need to get yourself exposed to the EP lab, the device clinics, look at ECGs, try to determine what the rhythms are, look at chest x-rays after people have had implants. Really important. Go down to the lab when they're doing, if you really want to get an EP certification as opposed to device certification, and even if you want to get a device certification, go down to the lab, watch them do some implants, look at the different fluoroscopic views. Where's the catheter going? Where is that lead going? What vessel is it in? Because there are questions about radiology on the exams. What's going on with the device interrogation? Look over people's shoulders, ask the reps, hey, what's going on with this? Is this an ATAC? Is this a VT? Why did that therapy get delivered? Try to learn. It's all about learning and then demonstrating that you have a command of that knowledge. So ask questions, be curious. It's all about learning, and just learn as much as you can about everything that you can. It's a lot of fun. We love what we do in EP and device therapy. We got a lot of great people, and boy, everybody I know just loves to teach too. They want to explain things. They want to teach the young upcomers. And if you've got a great question, we'll sit down and we'll go to the mat with you to try to explain what that's all about. So learn as much as you can, and then demonstrate that knowledge by taking and passing one of the exams.
Wow, that's wonderful advice. And there was a little insider hint there. Look at the chest x-rays.
Absolutely. It's really important. And not just that, but the fluoroscopy. Go down, watch some implants. I know we've got some people in our clinics that, they just don't, they're so busy with everything, doing remotes and doing interrogations and answering the phones, but you got to take a little time out, go down, watch them do an implant, watch a CRT go in and watch them do the venograms. Ask them, which one's the middle cardiac vein? Which one's the posterior lateral vein? Start to learn about those things. And then it makes your mind work better. And when you start talking about programming different vectors on a left ventricular lead, you'll know what we're talking about. You'll see those electrodes on there and where they're sitting. Watch the diaphragm jump when they have the phrenic nerve stimulation. It's interesting. It's kind of fun.
Yeah, absolutely. Well, Dr. Love, thank you so much for providing this great overview of IBHRE certification and the recertification process. And I personally would encourage all heart rhythm allied professionals to consider becoming certified, just for not only for your professional development, but, making you more marketable, certainly, and just, contributing to better patient outcomes, which again, at the end of the day, that's what we're all here for, is to provide better patient care. So
absolutely. And if you come to HRS, come to our booth. We have staff there all the time. We'd love to talk to you about the exam, how to prepare for it, what kind of things are going on. Go to the website, ibhre.org. There's a manual there, a handbook that you can review. It's got our content outlined, so you can see the different areas that we're going to test on and the percentages of questions that apply to each of those categories. So we might have 1 or 2% going after one category, but we might have 30% after another category. So that helps you focus your review, focus your education on the areas. And there's a great course for the people that want to do the CCDS exam, the device exam. We've got a nice course on that has a wonderful practice exam at the end, so you can identify any areas where you still need work. A lot of different opportunities, and HRS has a lot of great learning opportunities on the HRS 365 site. So just learn, and have a good time with it. It's a lot of fun.
Absolutely. Well, thank you very much, Dr. Love. This is Julie Shea for Heart Rhythm TV. Please check us out on our YouTube channel.